let's go ahead and segue into trend one around the response to the COVID-19 pandemic. And maybe you could comment a little bit on what the data found, and then we can get Jonathan's feet on the street perspective on that.
Great, great. Well, like I said, we did a study and analysis of the impact of COVID-19 on bioprocessing. And what we found was we're in an array of areas where there was concerns and so forth, but a lot of it, 75% of the bioprocessing decision makers are fearing the shortages of single-use technologies and other supplies, including things like violin and so forth. But 75% are really concerned about the shortage of the supplies right now as a result of COVID. In addition, the prioritization, which is moving the already constrained industry pre-COVID, is now essentially being constrained even more by the requirements of this high priority crisis we're facing. So, and all of those products, the non-COVID projects were still vital. So it's not like we can just turn them off. So what's happening is those who are involved in COVID production are now focusing on these priorities. But those projects that are no longer COVID focused now have to find a home, and it will either be internal or external. And much of what we've seen here is a very significant increase in the outsourcing of a lot of the projects. And that's been the result of that is a real shortage, not just in products and supplies for bioprocessing, but also for contract manufacturing, which is a great segue to Jonathan.
Yeah, thanks, Eric. And I think the data is really interesting here, and it certainly reflects what we've seen in Fujifilm, Diosynth, Biotechnologies. Certainly, there's just not enough single-use capacity out there, and it's sort of accelerated a lot of our deployment of further capacity that we had in the plan for the future years. You mentioned the second point there about prioritization, and that will hurt, and that really is something that's hit us. You know, we're a service provider to the industry, and there's been a lot of disruption where we've had to move capacity around. We've got to reprioritize programs to get these COVID projects through process development into the manufacturing capacity. And of course, that's disrupting a pipeline of existing molecules that were going through those clinics. That prioritization is something that we really feel, and actually our clients really feel as well. And in terms of those shortages, you know, again, you're absolutely true. We're having to prioritize. We're trying to make sure that we've got the right single-use components being delivered in the right facility at the right time to hit these really aggressive timelines.
Yeah, absolutely. That was a very common theme. The last point I wanted to bring up here was developers have significant fears associated with shortages of supply, because obviously they need to have those supplies. However, and this is, I think, one of the takeaways here from this finding, is the fears of shortages we've seen for decades, years if not decades. The fear of shortages are often greater than the fear than the reality. So what we would recommend that suppliers do, because this is on the supplier to do this, would be to ensure that they are communicating effectively with their customers and clients, to ensure that they understand that if there is going to be a shortage, that the customer, even though it's bad news, can prepare for it. If there's not going to be a shortage, or for a particular connector or single-use technology, for example, then they should also be aware of that, so that they can focus on other bigger concerns. But lack of communication in this segment, I think, is one of the key things that's driving this fear factor, and that's something that's easily repaired.